I'm Dr. Jeffrey Hartog, plastic surgeon and medical director of the Bougainvillea Clinique. One of the most frustrating things to me as a plastic surgeon is the confusion related to liposuction procedures, and particularly the hype related to procedures such as SmartLipo. Don't get me wrong, SmartLipo is a great tool that can help us get improved liposuction results in certain situations, but it is not a replacement for the skill and experience of a trained, board-certified plastic surgeon, nor does it replace other liposuction methods. Firstly, the name SmartLipo is misleading. SmartLipo by itself is in fact not liposuction. It is simply a thin laser device that melts fat to some degree and helps get better skin retraction, essentially by putting energy in the form of heat into the collagen, which results in collagen remodeling and skin retraction. For any reasonable amount of fat removal, one still has to remove the fat with actual vacuum liposuction after one has used the SmartLipo laser device. In this video, we'll briefly demonstrate the use of the SmartLipo laser, followed by the actual fat removal with liposuction using the micro-air PowerLipo device. We see the actual Cynosure SmartLipo laser machine here, and a thin laser fiber is attached to it, which we can see here about to be used on a patient. The red light you see at the tip is just a guiding light, not the actual laser. This guiding light helps us to see where the tip of the laser is under the skin, as is clearly shown when the lights are turned down. Essentially, the SmartLipo part of the procedure is shown here, where the laser is passed back and forth, putting laser energy into the deeper fat as well as the collagen just below the skin. Once the SmartLipo laser part of the procedure is completed, we then perform the actual liposuction. This is the micro-air PowerLipo device that I use. This device makes the actual suction cannula or tube vibrate at a high frequency so that the cannula can pass easily and smoothly through the fat as the suction is applied and the fat is removed. Combining SmartLipo with PowerLipo helps us to get smoother results with better skin retraction in cases where the skin is loose and we need some help to get the skin to shrink and tighten more than we can get with liposuction alone. The actual scientific data seems to show that you can expect 15 to 20% better skin retraction when we add SmartLipo. But remember, SmartLipo is just the laser part of the procedure, not the actual liposuction. With regard to SmartLipo having the advantage of being performed under local anesthesia, this is not unique to SmartLipo. All liposuction can potentially be performed under local anesthesia if the amount of liposuction is limited and the patient chooses local anesthesia. For larger areas of liposuction and anxious patients, we still recommend adding intravenous sedation to the procedure or even general anesthetic, if the patient prefers. Do not be fooled by practitioners who insist that the procedure must be performed under local anesthesia. Very frequently, they do not have the facilities or licenses to provide sedation or general anesthesia if you prefer it.